Good morning, everybody, and thank you, Deirdre. Already I'm learning. Like as a community pharmacist, we don't actually dispense the heavy drugs that you'd be on, but we're there, to support you in every aspect really of your treatment, and just as general community pharmacy. So I was asked to come along today just maybe to give you an idea a little bit about what pharmacists can do for you, and please ask us, so it really, that's the biggest part of it. So as pharmacists, we don't really mind saying we're fairly expert on medicines in general, so you can ask us anything about a medicine, even if we don't dispense it for you. Come and ask us. We can talk about the side effects, what to expect if you're on it, and all of that. And we can talk about prescription schemes, because kind of the logistics of applying for a medical card or paying for your medicines on the drug payment scheme. Are things allowed in different schemes? What about generics? All of that. We are very willing to discuss it with you and facilitate you. Provide application forms and explain that, and do some of the running around for you to as much as possible explain the high tech scheme. If you've had surgery, post-surgery wound management, sourcing dressings, what to take for pain, all of that. And just general health then as well, which is, as Deirdre pointed out, just general health and well-being is really important to good recovery, and how to deal with lack of energy and how to avoid infections and that. I think what can happen for a lot of women with ovarian cancer is that you can be thrown into a sudden menopause if you have surgery, and this is just a slide that now all women probably have to go through the menopause, and for a lot of women it's fine, they get away with murder. 25% have almost no symptoms, and they don't have they don't get the itchy dry skin, they don't get bitchy humour, but the night sweats and the bloating and the sleepy problems and being forgetful, and sometimes some people end up on maybe medicines they've never had before because of the psychological effects of menopause. But there are ways around it. So sudden or early menopause, particularly if it's induced with surgery, with removal of the ovaries, can have a big impact on you. Things like hot flushes, night sweats and mood swings, as well as coping with the diagnosis of OC can, really take its toll. For some people, HRT may be an option, but you have to discuss it with your oncologist, because it depends on the type of cancer that's being diagnosed or whatever. Because if it's estrogen dependent, it won't be possible. In other cases, then you may be able to use some of the alternative products that are available through pharmacies and health food shops, that contain the phytoestrogens. So these are estrogens that are available from the plant source. So they can help to improve, which the most common symptom really that people complain about is hot flushes. Ginseng and the Chinese herb Dong Quai or the Novogen red clover can help to boost estrogen levels as well. So have a chat with your pharmacist, have a chat with your oncologist, and see if it's something that you'll benefit from. Soy products and vitamin E are useful options as well, and there are creams and gels available on prescription for vaginal dryness, so they're very useful as well. And I should say that these slides are available from Sharon later if she'll send them to you if you need them, because I'm sorry about they're a bit heavy on information, but I felt that if I put it in, at least it's there for you, and if you don't need it, it's fine. But healthy lifestyle, it will help your menopausal symptoms, but it'll help us all in general, just to try and buy into the healthy lifestyle as much as possible. And exercise will help us does help with anxiety, because exercise releases endorphins, our happy hormones, so it really does help us to feel a little bit better. Like when you get out for a walk on a day like this, you really do feel better when you get back, once you have the energy to do it, that is. But just and you also get the added benefit of strengthening our bones and improving our heart health. The healthy balanced diet, I know it all goes back to the food pyramid and the healthy lifestyle, but it really is something that to keep reminding ourselves, and to keep up the fruit and veg and watch the fats a bit. We do provide, most pharmacies do have a huge range of multivitamin supplements, which can help to balance up, if you're missing something in your diet, or you're particularly low on a particular vitamin or supplement, it really does help maybe to boost your immunity when you're watching your risk of infections and that. For instance, vitamin D is very essential for good bone health, and you can get that. Okay, it's found in our diet in oily fish, dairy products, and linseeds. But if your diet is very restricted, if you're not managing to eat everything that you like to eat, you can maybe think about whether a supplement will help you or not. Yoga and meditation are really nice, just for the anxiety and stress, just to help to calm us all down a little bit. So just to think about that, just what works for yourself really, find a quiet space in that. And aromatherapy oils can help you know, lavender is nice. If you're finding it difficult to sleep at night, you know, just to use some of those little products. They're just nice adjuncts to, you know, just being nice to yourself really, and using things in your lifestyle that make you feel, you know, a nice aromatherapy oil in the bedroom or whatever, you know, just sets a nice mood. Just then to talk about the chemotherapy drugs that are used. Now, I understand that you're probably more familiar with them than I am really, and familiar with the side effects, but just for the next few slides, I'll just talk about the common side effects. And not everybody gets these, and most of them are reversible. But it's just to highlight them really. Like the increased risk of infection is the biggest thing, because the chemo will knock out your white cells which fight infection. That puts at bigger risk then of picking up anything that's going, a virus or bacterial infection, particularly in the winter months. So if you feel you have any signs or symptoms of an infection, you should report it immediately. Contact your treatment centre and they will advise you on what to do, and particularly if your temperature stays above 38 degrees centigrade. The tiredness and the fatigue is inevitable really with these, with chemotherapy. It knocks out the red blood cells, which means there's less oxygen floating in the body, so that's why you're so tired. But you will bounce back, but you need to plan your recovery. So after a session or a cycle of chemo where you know you're going to be whack tired within a few days or within a week or 10 days, just give yourself time and plan around it. Hair loss doesn't occur with every single medicine. Like with Taxol, sometimes they might use a cold cap. It depends on the drug being used, but by using the cold cap it reduces circulation to the hair and less of the drug gets there, so it helps to minimise the hair loss. So again, your oncology nurses are specialists in this really, so talk to them about that. The nausea, where you feel sick, may not be vomiting but just feeling ill or not able to eat that well, but both nausea and vomiting should be very well managed as much as possible. There are a huge range of medicines available, both as tablet form and injection for the nausea. Sometimes you get tingling or numbness in the hands or feet from the medicines. It really depends on the drugs being used, and it usually goes once the treatment is finished. Sore mouth and soreness down the throat is very easily treated with something like mycostatin oral suspension. We'd have a lot of chemo patients would have that regularly on their prescription. It's a little bottle of yellow liquid that you hold in the mouth as much as possible, and you need to use it over 5 to 7 days. Or Dactarin oral gel, you can buy that over the counter without a prescription if you think that it's an antifungal. Again, it does help. It's important to maintain your vitamin B intake, because we need vitamin B complex really for all these new cells that new cell growth. So for things like good mouth health and good GI, good stomach health, good intake of vitamin B is recommended. Some people will get diarrhea from their treatment, and again, drinking the water is so important, because the biggest risk with diarrhea really is dehydration. It really wrecks you and the cramps and that. So drinking at least 2 to 3 litres of water a day is what's recommended. There are antidiarrheals that you can buy over the counter, like Arette and Imodium are both the same medicine actually. They both contain loperamide, which is very effective for stopping it. So it will help. Aching muscles, arthralgia, or aching joints can be a side effect from some of the medicines that you're on, and it might last just for a few days after the treatment and can be treated with mild painkillers, provided that they're suitable for you. Paracetamol generally is fine for most people. Ibuprofen, if you don't have any problem with your digestion or that you don't have asthma, ibuprofen is fine as well. Again, you would need to take it with food. But again, ask your pharmacist. So just to look at some of the drugs that now you probably could tell me more about this than I know myself, but Taxol has been on the market for about 20 years, give or take, and it is still being used. It's made from the needles of a strain of yew tree, and it works by stopping cancer cells from growing. So like many of the drugs, it's given by an injection into your vein as an infusion. They'll often give a steroid injection or tablets beforehand to prevent an allergic reaction, and sometimes the Taxol can make you feel a little bit tipsy because they dissolve it in alcohol. It's the equivalent of having a large glass of wine, so I don't think you'll object too much to that. So some of the other, as well as the common side effects that I mentioned earlier, Taxol can also cause reaction around the injection site, And if this happens, you should report it. If you, some people get mild skin rashes or nail changes. Liver changes tend to be mild, and they will do regular blood tests in the treatment centre. So they'll keep an eye on that, but it's not really a big issue. So they do, the blood test will keep an eye on that. One of the older drugs, Carboplatin, has been around for quite a while and it's still used. It's given over several cycles, for over 21-day cycles. It has less side effects than cisplatin, which is its parent compound. It's an alkylating agent, so that means it interferes with cell DNA, so it stops cancer cells dividing, so they eventually die. Like when they give the infusion, as you know, you get into your arm, sometimes they might do a central line and give it to the abdominal cavity, peritoneal cavity, just that it just goes into a different space in your body, but it still gets there. As well as the common side effects, it can often cause taste changes, blood test abnormalities, that it'll alter magnesium levels. Some people will get a bit of burning around the injection site, mild kidney problems, hearing loss or heart problems, but these tend to be very minimal and serious in less than 1% of people. The parent compound, cisplatin, has more noticeable side effects. They tend to be a little bit stronger. Again, with all of these medicines, the dose that you're given will depend very much on you as an individual. Your oncologist will decide on how your general health is, your BMI, your height, your weight, and now they're also looking at people's muscle mass to see how much of the cancer drugs that they can tolerate. And so your dose and your cycles are really individualised for you. But cisplatin is an irritant, so you can get a bit of redness at the injection site. They will give you extra fluids on your treatment day to reduce the effect on the kidneys. Again, with a lot of these medicines, you'd see a low blood count hitting at a certain time. So it happens with cisplatin after 2 to 3 weeks after the cycle, and it will recover then within 3 to 5 weeks. So like you hit a little bit of a low in terms of fatigue and energy levels when the red blood cells really drop. But they will come back. Your bone marrow will push them out again. Other less common side effects where you get peripheral tingling in the hands or feet, high frequency hearing loss, loss of appetite, taste changes and hair loss. But the hair loss only occurs in up to 30% of people, so not every drug will cause you to lose your hair. So, bear that in mind. It is, while it is, I suppose it's a bit distressing to lose your hair, it doesn't necessarily have to happen to everybody. Cyclophosphamide has been around for a long time. It's another alkylating agent. I worked in CUH for 2 years, and it was being used back in the 90s, and it's still being used, widely used for many years. It's given by mouth as tablets or by IV drip. And with a lot of these medicines, you know better than me that they never really use one drug at a time. You get a combination of drugs used together, tailored again to your particular treatment. Cyclophosphamide will cause temporary hair loss and discoloration of the skin or nails, as well as some of the other side effects that I've mentioned. But again, hopefully they won't be so bad. And as Deirdre said, it is doable, just to get past it eventually. Gemcitabine is a relatively new drug which has been made by Eli Lilly. It's an anti-metabolite, so it stops cancer cells working properly. Given again over an IV infusion of 30 minutes. They will give it over several cycles and then stop and give your body time to rest from the effects. Again, other common side effects, you can get bruising and bleeding, particularly if you're brushing your teeth, get a little bit of bleeding. So use a soft toothbrush if this is one of the problems for you. You do need to report any bleeding that won't stop, but like a little bit of bruising isn't unusual. Again, after the treatment you might feel very tired, so it's recommended to avoid alcohol. Some people will get flu-like symptoms, about 2 in 10. So it's okay to take a bit of paracetamol, 2 tablets every 6 to 8 hours is fine. That's just after the treatment. But if it goes on for any bit longer, you should report it. Again, you should also report any swelling if your face or hands or feet swell. That should be reported. But your nurses will keep you on track when you're leaving. They'll advise you what to watch out for and what to report. You can get a little bit of hair thinning and skin rash with Gemzar as well. One of the other drugs that's used is Doxorubicin. This was licensed about 6 years ago for a number of cancers, including ovarian cancer, in women whose previous treatment had stopped working. It's given every 4 weeks, as long as the disease does not get worse and the patient can tolerate the treatment. So again, it's individualised for you, depending on how well you're doing. It interferes with DNA cells, so that it just stops cancer cells from dividing and multiplying. What's good about it is that it concentrates itself into the cancer tumour, so you tend to get less side effects on the rest of the body. And they also make it in tiny little fatty spears to reduce its effect on non-cancer tissues. So it's, you know, they're really starting to target the cancer more specifically now with the newer drugs, so that you get less general side effects. They found that doxorubicin is as effective as topotecan in extending the time until the disease got worse. So the results are pretty good from this drug. Other side effects include redness and pain in your hands and feet and some inflammation in the mouth and throat. But again, a lot of these side effects improve once the treatment is gone and finished. Topotecan, or Hycamitin, is the trade name. It's used for cancer that may have spread. It blocks, again, the ability of cancer cells to make and repair their DNA. And this is really vital for the cancer to survive. So by blocking this, it helps to clear it. It's usually given every day for about 5 days, and then followed by a break of 21 days. And the side effects would be similar to those mentioned earlier. Another drug called Avastin. This is one of the newer family of drugs, the monoclonal antibodies. I can't pronounce this. Avastin, anyway, has been developed to target a specific protein in cancer cells, and it causes an immune response against the cancer cells. So it's bringing in your immune system into the treatment, and so this particular treatment slows the growth of new blood vessels in a tumour, so it reduces its ability to survive. It's usually given in combination with other drugs like topotecan, doxorubicin or Taxol, but it's not given as a first-line treatment. It tends to be used at a later stage. As well as the usual side effects, it can cause shortness of breath, high blood pressure or weight loss, but these are fairly manageable really. Monoclonal antibodies are widely used now in treating, like we have a lot of people using them for different conditions like rheumatoid arthritis, Crohn's disease, ulcerative colitis and other diseases. Like it's really been, they're sort of seen as a bit of a magic bullet really, because they're very targeted at the treatment, and the results are quite good with them, so they're very favoured. One of the very new treatments are the PARP inhibitors. The FDA only approved its first one last December, and olaparib, or Linzaparza is the trade name, is licensed in this country since January this year for ovarian cancer, and there are trials on other PARP inhibitors for use in breast cancer. So in cancer treatment, they found that blocking this PARP enzyme can help to keep the cancer cells from repairing themselves and their damaged DNA, so it causes them to die. So it's a very targeted therapy, and they found really with the PARP inhibitors that they target people with specific genetic mutations. They call them BRCA mutations, and these are tumour suppressing genes. So it's very linked to genetics. So there's a lot of research going on, like there would be a certain amount of genetic testing with the patient to see whether these will work with you or not. They're probably quite expensive because they're so new, but currently olaparib is licensed as monotherapy for treating patients with germline BRCA mutated ovarian, fallopian tube or primary peritoneal cancer. And it's given orally, that's probably a positive thing, it's given as a capsule twice a day. And so this is opening up a new area of treatment, and hopefully the results will be positive and useful. Some people may have to have radiotherapy, so I just wanted to mention some of the things to expect with it. In radiotherapy, they use high energy rays to cure or to control a cancer, and sometimes they might decide that they will give it before or after surgery, or before or after chemo, as a combination. It would take you about 15 or 20 minutes, depends on the hospital how long you'll be there, but the actual treatment itself generally only lasts for about 5 minutes. But you tend to have to go most days for the number of weeks, up to 8 weeks that you're being treated. And with radiotherapy, its main effects are on the skin, so your skin can get dry or itchy or blister a little bit or peel. I would take the advice from the oncology nurses there about what's the best thing to use on your skin, because just to deal with the slight burning. Like I know one guy, he was been treated for a different cancer, but was having radiotherapy, but he found Sudocrem for his bum was the best thing ever. It was prostate cancer he's been treated for, but there are loads of options as to what you can use. But radiotherapy will make you tired as well. So feeling tired and exhausted almost all of the time. It's more likely if you're on combination treatments like chemo with radiotherapy. Again, the advice is a healthy diet and get as much rest and sleep as you can manage, you know, to keep your energy levels at some manageable way. Again, seek advice, and this is across the board. Like, there are so many services available and so many supports for people with a cancer diagnosis and for their families. Like, use the Daffodil supports, Ark House in Cork. Seek advice as you need it for stress and anxiety, because it isn't like every day isn't a cakewalk. Sometimes taking a good vitamin supplement can give you that little extra bit of pep that you're missing, which is available, you know, that we can help you with in the pharmacy. Something like with ginseng or vitamin D. But you do need to always check with your pharmacist and your doctors if it's okay for you to take extra supplements with your medicines. That's really important. One of the most common side effects is nausea and vomiting, and it's very common with chemotherapy. There's a huge choice of medicines available, so you really shouldn't be very ill with it. You know, you try to, you know, ask and use what's available to help you as much as possible. From something such as simple as Motilium, which is available over the counter. Now, it has to be sold under the supervision of your pharmacist, because they found that there's some possible side effects on older people, particularly if you have a heart condition. So Motilium isn't as the instant cure that it always was, but it is useful. Other medicines that are useful for nausea are things like Maxilon, Stemetil and Valoid. They're all available on prescription and will be prescribed for you by your treatment centre. The main thing really about using the anti-nausea medicines is don't take them all together. We had a patient who was only diagnosed a few weeks ago, and she went in for her first cycle of treatment, and she took every single tablet that she had for nausea and vomiting. So then the nurses were saying, what did she do? It was like she was just anxious and confused. But just take one at a time, and if that one doesn't work, then switch to something else and find out what works for you and go with that. And if none of them work, if none of those basic ones work, they can look at Zofran or Kytril, which are these work on the serotonin receptors. These are the newer, more expensive anti-nausea medicines, which again are very useful for most people. And as Deirdre said, then Amend is another option. So there are a huge range of both oral and injectable anti-nausea medicines available. So don't ever be afraid to say, this isn't working, I feel sick all the time. Keep talking to us, keep talking to your carers, and you'll get sorted. Pain relief, again, there's a whole plethora of pain relief on the market in terms of prescription medicines as well as over the counter. And sometimes when you're feeling a bit sick and a bit, you're just not able to think straight about come and ask us, and we, as pharmacists, we can talk you through pain management. And if you know you're going to be sore, if you know you're going to have pain, take things ahead. Don't wait until you're really sore to actually treat the pain. It's much easier to knock it on the head with a mild dose of analgesics rather than just waiting until you're really sore, because sometimes it might take 2 doses and take 6 hours maybe to really hit it. So we would prescribe it recommend it according to a stepwise pain ladder. So like anti-inflammatories are often used because they're very good for bone pain, provided they suit you. So we would give you all particular advice around particular medicines. Things with codeine and morphine, they're great for knocking out pain, but they do come with some side effects, such as constipation. The body gets dependent on things like codeine and morphine, which is fine. I wouldn't worry about it too much. If you have pain that you need to take these, you take them, and deal with the side effects later. But you won't be, oh my goodness, I've been given something with morphine in it, I'm going to be as high as a kite. You won't be, because your pain receptors will soak up the morphine if you need it to kill the pain. It's only the extra stuff. It's only if you take too much that it's floating around in your system and giving you kind of psychological side effects. But again, follow the advice from your pharmacist about following your prescription and when to take them, and what codeine can cause constipation. How do you deal with that? And we'll help you with that as well. So plenty of fruit, fibre and fluids really is the main thing to deal with constipation. But there are some laxatives available to help you to deal with constipation. The constipation can arise for so many different reasons, whether you have a restricted diet and you're not getting as much fibre as you'd normally like, you're not drinking enough fluids, Exercise, if you're kind of immobile by virtue of having had surgery or whatever, just getting back to your usual routine will help with constipation, and some of the medicines can do it. So adjust your lifestyle as much as you can to deal with it, and take the laxatives. Now, the stimulant laxatives like Senecot and Dulcolax are fine, but only take those for 2 or 3 days, because your body will get dependent on them and you'll get a bit of a lazy bowel if you use them all the time. So it's recommended really to look at something like an osmotic laxative. These just draw water into the colon and help to keep the stool soft. So Laxos or Duflac are fine for that. If they don't work, something like Movicol sachets, they're very popular, and we have a huge, like loads of our patients use them, young and old, to keep the stool soft, and that's the aim really, to avoid constipation. You can use fibre gel, which is like replacing, it's a fibre supplement really, but it tends to swell up in the gut, so you need to be fairly active if you're taking fibre gel. So only take it if it's recommended for you. And if you need something that's, some people get impaction, where you need something to relieve the constipation immediately, you can get enemas from the pharmacy. Just come and talk to us, and we can sell those to you over the counter. Just another one of the side effects is diarrhea, and you need to be sure what need to have some idea of the cause, because if you know what may have caused it, you'll know how to treat it. With a low, with kind of a low immunity maybe, or an increased risk of infection, you can sometimes pick up a virus or a tummy bug more quickly. So in that situation, just treat it with fluid replacement and diurolite first of all, and then if it lasts a day or two, use something like Imodium. If it's caused by your chemotherapy or your treatment cycle, it's probably easier to manage it. It's take the loperamide as prescribed, and it will be prescribed for you by the treatment unit. Again, if it goes on for more than 3 or 4 days and you're not getting any better, you do need to ring somebody, ring your GP, ring your oncology nurse or contact, and see what the story is. They might like to talk to you about why it's not clearing up. But again, it's the most important thing really is hydration, because the effects of dehydration are more debilitating really than any other symptom. Avoiding infection is really important for you when you're particularly going through cycles of chemo. So to stay away from crowded places like supermarkets and shopping centres, even in a kind of an air conditioned room like this, if somebody sneezed, they can infect the whole room. So just to be aware of what of infection. If you can remember a number of years ago where H1N1 was a very prevalent virus causing flu, and there was the advertising campaign was fantastic, and I think it definitely reduced the incidence of infection in the community. Just the hand hygiene. So hand hygiene is really the key to avoiding commonly transmitted infections, particularly viruses. So wash your hands regularly, always before eating. Don't come into direct contact with anybody with an infectious condition. If they have a chest infection, a cold, stay away from them. And don't have a vaccination either, especially a live vaccination within 6 months of you having your chemo. The live vaccinations that they use in this country are those for rubella, mumps or measles, that's the MMR, the BCG, yellow fever, or vaccine for shingles. So just be careful, always have that double checked and triple checked that you are safe if you need to go ahead and have a vaccination for any reason. Probiotics can help you to help boost your immunity as well as the omegas. So you can try to have them in your diet, and if not, think about a supplement. And again, safe food choices will help to avoid tummy bugs. We're immune to the bugs living in our own kitchen because we're living with them all the time. But eating out of somebody else's kitchen can bring us into contact with microbes that we don't have the same level of resistance to. So while it's nice to go out for a meal and that, be careful about where you choose to go, and takeaways and that. Be selective, just in terms of good food choices. In terms of skincare then, there's a huge range, as you know, of skin products available across the board in most pharmacies. And if you have very dry skin, things like the Roche-Posay range, there's lots of different ranges that are really nice. What I would say really is pamper yourself a little bit. If you look good, you'll feel better. So follow all of the the advice about keeping up your own, when you're getting out, you know, make a small effort, because if you go out and you look a little bit better and you don't feel so exhausted and wrecked, you just will feel better and it will help your recovery. I would recommend for dry skin and that you use your moisturisers regularly and use the ones that suit you the best. They don't have to be really expensive, but regular use is the best advice. Avoid anything that's perfumed that can cause an allergy, and that would include anything in your lifestyle like washing powders, fabric softeners, or anything that can trigger, you know, a reaction on your skin. Just be careful with those. So as a pharmacist, like, we're here, come and ask us. You know, there's community pharmacies in every town and village in the country, and while we appear to be very busy, we are very open to having a chat with you about your medicines and supporting you with your prescriptions. Lots of pharmacies will deliver your medicines, or, you know, no problem ordering in whatever is available for your treatment. And if you need to look up any more information, medicines.ie and the HPRA and the IPU website are pretty useful sources of information. But I wouldn't be looking up all of the side effects. You know, if you have them, you'll deal with them. But almost all medicines have side effects. But hopefully, your medicines will work for you and make you feel better. And that's what I wish for you all: good health and happiness. Thank you.
Thank you, Sheila. I think looking at the messages there, you know, when we are low and lacking in energy, it's vital that we focus on minding ourselves, and sometimes we might have the motivation to do so. Things like healthy lifestyle, getting out there and taking exercise, but everything from supplements to oils, creams and other treatments. The big thing I thought, though, is that it's totally understandable that we wouldn't have a clue about the amount of things that are out there to help us, but go and talk to your pharmacist. There was a man one time, though, at the marriage feast in Cana, who turned water into wine. Today at the Ovacare Patient Day in Cork, you managed to turn Taxol into wine. So well done, Sheila, a major achievement.